textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps.
We are making sure comes into being between Africa and the US. And having this summit happening here.
For calls to action with Cancer Moonshot to be involved, you have our commitment and our partnership to make significant progress.
The commitment to partner in cancer, as you know, use is really, really important. I think that coming out of this, we're going to have a more serious conversation about that. Really important. That's what the global health is going to be about collaboration. And I think that's a major.
And I'm at the Global Health Catalyst Summit. This year it's at the Johns Hopkins University, our medical center. And with me is somebody from the National Cancer Institute. And I'll let him introduce himself so I don't mispronounce his name. And he'll tell us what why he's here. Welcome to the show, Doctor.
Thanks very much. So I'm Satish Gopal, and I direct the Center for Global Health at the United States National Cancer Institute.
All right, and so people who are not into, the healthcare system, what does that mean?
So the NCI, as we call it, is the U.S. government agency that's tasked with supporting really all areas of cancer research with the goal of improving people's lives. Right. We happen to be the largest funder of cancer research in the world, and have a large international portfolio, including a sizable body of work in sub-Saharan Africa. I direct the Center for Global Health, which is the part of the NCI that has responsibility for really trying to expand and coordinate our global activities with a particular focus on low and middle income countries, which is where much of our efforts are concentrated at the Center for Global Health.
And what does this Global Health Summit mean to you as someone who works at the NCI, but also to NCI?
Well, I think it's a remarkable effort to bring together diverse groups of stakeholders from within Africa, as well as from here in the US, from the public and private sectors, including many governmental representatives. It was great to hear this morning from ambassadors to the AU, as well as from specific countries and their ambassadors to the US. So I think that's the kind of broad-based support that is needed to tackle a problem as large and important and urgent as cancer.
As somebody, I know that you've lived in two worlds, both in Africa and now here. What are some of the gaps that you've identified that could be bridged by a process like the Global Health Catalyst?
I mean, the gaps are enormous, so it's hard to stop with just a couple, but I think the reality is we have been incredibly successful in many facets of cancer research. And we take great pride in that at the NCI as an important supporter of cancer research. So we've seen important therapeutic developments, important developments around cancer prevention, exciting new technologies, application of artificial intelligence and machine learning approaches, a deep genomic-based understanding of how cancer occurs and how we might better treat it based on a fundamental understanding of biology. So those are all tremendous successes, but we know that that hasn't always translated into reduced morbidity and mortality related to cancer, especially for some populations, including many people living and work in sub-Saharan Africa. And so, how to continue supporting these types of discoveries while ensuring that the discoveries are brought to bear on the actual lives of people and the health of communities, I would say that's an intense area of thinking and conceptual development currently at the NCI.
Right. So my next question is kind of twofold. You mentioned AI as part of the healthcare infrastructure. So looking at just the commission, Oncology Commission, what do you see the NCI's role as? And one of the other programs that the Global Health Catalyst is looking at is the tumor boards, and again, knowing the challenges with infrastructure in Africa, especially with the internet and all that. What do you see your role as?
I mean, our role, I think, is one among many, as we alluded to earlier, I think a concerted cancer-focused effort really requires a number of different partners with different capabilities. Indeed, that is extremely well reflected in the approach to the current Reignited Cancer Moonshot in the United States, which has very clearly been directed by the president to be a all-of-government approach. That is, we know that there are different governmental entities with different capabilities and expertise, and we at the NCI, being the largest funder of cancer research in the world, are specifically leading, I think, many of the cancer research efforts. That is, what are the research outputs and programs that are needed to really drive discoveries that will improve the health of populations. And I think that's the way in which we would continue to participate in the commission, along with many of the other stakeholders that are already engaged. I think among the priority actions that were identified by the commission, there was a focus on innovation and research, which is very closely aligned with our mission. There was a priority action focused on workforce development, and we are very eager to support the next generation of cancer researchers, not only in the US, but internationally as well, who can really drive the discoveries that we will need going forward. There's also efforts to improve cure, and we at the NCI support major clinical trial efforts that are designed to define the best treatments for cancer patients, including all around the world. And then there was also a focus on national cancer control policies, and this too is an area where we have always tried to be mindful of ensuring that our science informs policy and practice, and we have a whole number of dissemination platforms, including an effort that we support called the International Cancer Control Partnership that really allows countries that are trying to develop cancer control plans that are evidence-based to receive the technical expertise that they need and want as they're developing, implementing, and evaluating those plans.
Right, and just for the sake of everyone watching that might not understand what this Cancer Moonshot is, could you kindly briefly explain what it is?
So the original version of the Cancer Moonshot was initiated in 2017 in the Obama-Biden administration, and then Vice President Biden really oversaw that effort, which is still ongoing. Many people don't realize that, but the original Moonshot effort was a 7-year effort that is still ongoing. And actually, so we have major new programs at the NCI that were developed with new funding and resources that were provided by the original Moonshot that have yielded really important results, generated new platforms, generated new open data sources that are available to the cancer research community. So there's an enormous amount of infrastructure that's been developed through the original phase of the Moonshot, which is ending next year. Earlier this year, the president, now President Biden, shortly after taking office, announced this goal of reigniting the Cancer Moonshot. So we call this Cancer Moonshot 2.0, which is essentially a continuation of the original Moonshot, which has been ongoing. And I think that there are two major national priorities that have been articulated as part of the Reignited Cancer Moonshot, which is intended, as I mentioned, to be an all-of-government approach. And we at the NCI are certainly active participants in all of these discussions, and I think leading many of the research themes that are emerging. And But the two national goals that have been articulated as part of the Reigniting Cancer Moonshot are to reduce the cancer death rate in the United States by 50% over the next 25 years. Cancer death rates in the United States have been declining in recent decades, but this would be a significant acceleration of the pace at which cancer death rates have been declining in the United States. And so achieving this, I think, gives us an opportunity to think about now exactly how we would do this. That is, what are the major leverage points by which we can achieve that very ambitious goal of reducing cancer death rates by 50% in 25 years. The other thing that the president has asked us to be focused on is improving the experience of patients and families affected by cancer. And so this includes better screening methods that are more patient-friendly, more equitable access to effective cancer screening, treatment, and palliation, new treatments that are effective while sparing toxicities. So there's really even though there's not a quantifiable metric under that second national goal, there's a whole number of, I think, priorities emerging that we will have to tackle if we are to meet that second goal around improving the experience of patients and their families who are affected by cancer.
This is amazing. And just maybe finally, speaking of trends, you've talked about your target is to decrease cancer death rates by 50%. Cancer is broad. There are so many types of cancers. In your observation, what cancer has the most effective treatment or reduction in trends of death rates?
Yeah, so I think the cancer is very different, right? We talk about, I think, largely during this conversation, we've been talking about cancer as a single entity, but as a medical oncologist, I think we always think about cancer as hundreds, if not thousands, of disease, and many cancers that we have historically thought of as one disease, like breast cancer. Now, because of the research that the NCI has supported, we really understand that really breast cancer is a number of different diseases that can be identified at the molecular level, and this has importance because different subtypes often require different management approaches and even different prevention approaches. So that understanding is very important. I think different cancers, therefore, pose different problems and challenges. Some are highly amenable to prevention, others are difficult to prevent but can be treated. Some we don't have good prevention or treatment. And I think that's where we as a scientific community, as a technical community, once this broad national goal is articulated by our political leaders, and certainly it's been, President Biden has been personally affected by cancer, as he has spoken about on a number of occasions, and so that's large national goal. I think then we need to think about, if we're going to achieve that, we don't want to leave anyone behind. So achieving remarkable progress for some cancer while achieving no progress for other cancers, I think, is clearly not acceptable. Similarly, different cancers may have different leverage or intervention points. That is, for some it may be vaccination and screening, for others it may be more effective treatments, for some it may be better deployment of therapies that we already know work quite well, for some it may be minimizing toxicities given, and so I think that's where we need to focus our energies now in the years to come. And again, the nice thing is that this is a clearly articulated 25-year effort. So I think we're at the very early stages of mapping out what those specific priorities will be, including what the important global health collaboration opportunities will be. And I think we're thrilled to be participating in those discussions as the NCI, and certainly us as the Center for Global Health, with a specific focus on the international collaboration opportunities.
No, this is, again, great. I could have you here all day, just but in the interest of time, I won't ask as many, but as a mother of 2 young kids, I'm just curious about the trends of cancer in young children. What has been your observation? Are there any particular cancers of concern?
So childhood cancer happens to be an area where there's always been strong international collaboration because it is quite rare. And so often to really do good research and improve outcomes for patients, you really do have to band together across national borders. And I think there's a strong historical precedent for doing that in childhood cancer specifically. As a result, childhood cancer outcomes have improved remarkably in the last 40 to 50 years. So I think typically we think of 80 to 90% of all childhood cancer being cured in the United States currently. I think that's certainly not true in many parts of sub-Saharan Africa, where we, I think, grossly underestimate the amount of pediatric cancer that exists. So, when I lived and worked in sub-Saharan Africa, a lot of my own work was focused on lymphoma, which is a highly curable cancer that occurs very frequently in children and adults. And we know that those patients were not being cured at the same rates that we would expect in the United States for a whole variety of reasons. So I think there's major opportunities to improve outcomes for children all around the world, but particularly in low and middle income countries where they haven't benefited from a lot of the really exciting progress that we've seen in the United States and other high income countries.
Oh, absolutely. Thank you again. Thank you for your time. Thank you for being here. Is there any final word you have for our viewers about, the work you do?
I think it's a really exciting time in cancer research and a really exciting time in global health. And I think we are thrilled about the Reignited Cancer Moonshot and opportunities to participate and lead various aspects of that. I think this will really result in science that benefits patients all around the world in high and low income countries alike. And that's something that we are deeply committed to.
Thank you so much for your time.
Sure.
And thanks for all the work you're doing for healthcare systems.
Thank you.